artificial intelligence in health solution. I try to focus in solution in particular for neuroscience, and which is your subject, and care. Just introduction. Artificial intelligence is considered as enabling technology that can be used, of course, in all different health solutions. Was based basically since last year, let's say, it was very high consuming resource in terms of computing timing and human timing because of the training necessary labeling all data, which consume a lot of time. But nowadays AI is also generative and is no more is this kind of artificial intelligence not need a specific training in and supervision in labeling. That means that probably is going to be used in a very large ways in a lot of businesses. Okay, in the first case is a company, very young company called BioXcells. And in this case, artificial intelligence is used as means to find new repurposing drugs that has been used previously in for other disease. The repurposing drugs, repurposing is normally done by high throughput screening, but in this case, with intelligence, artificial intelligence or machine learning modeling is able to use not only the chemical knowledge to repurpose these molecules for other diseases, but is a very large platform that really is able to accelerate the process of the repurposing drugs. And in fact, the first objective is for this company is neuroscience, but has already created a new company, startup company called when using Nova, the same technology for immuno-oncology purposing. Another interesting company that I found is a spin-off company of the Oslo University Hospital, and using artificial intelligence to help funding health disease, comparing a lot of maps. It starts with a lot of data in maps the brain health, and is able to find biomarkers very fast. And this young company is also part of the AI Mind, which is an European Commission program based on artificial intelligence for dementia prevention. And is another clinical trial step, let's say, in the company. Okay, this company is called Starland, is very famous in Barcelona because born in 2010, and is one of the first company completely focused in neuroscience. And then they moved also to Boston to get bigger, to find investors. The company went very good, and nowadays the business is has moved a little bit from the technology by itself to a platform based in software as a service solution, and also spin out another company called Neuroelectronics, and what offers is basically diagnostic and treatment based on the analysis of the data in electroencephalography and other sensors that you know very well. Finally, I would like to finish with the two examples from two big companies. The first one is Siemens, that has ready-to-market solutions based on artificial intelligence. And basically what they sell is also platform, a whole platform with their own instrumentation for radiology, but also the data analysis processing to help radiologists to find also in a very fast and efficiency way diseases and strange images, let's say. On the other side, Philips, which is also is moving as Siemens on the health business, almost totally in the health business. Philips is using artificial intelligence to give a platform also, but focusing care solutions. This is called Health Continuum, and basically the objective is to link all the process of the connected to care, patient care, starting from the doctors and all the clinical decision makers. It is also a solution ready to market, and I said, and focusing in chronic disease and leak studies, so it helps the health structures to follow its patients. And that's all from my side.
Okay, so this is the session on European projects now, purely. Yeah, the agenda for today basically is I'll make a short introduction to Horizon Europe projects. May I know who is familiar in the public with Horizon Europe projects? Can you raise your hands just to know my audience? Okay, maybe have a bit less. Okay, good. So then this introduction will be nice, I hope. Then some tips on defining a suitable project concept, how to build a consortium, writing some tips also for writing a green proposal. I will explain very briefly about the evaluation process, how it works. And then I'll present you some topics of interest for the HybridNeuro community that are coming in the next few months. Okay. So a lot of things. I just have barely 5 minutes, so I hope it works. For the moment, everything under control. A joke to start with. We can only improve from now. Okay, so introduction to Horizon Europe. For those of you that don't know, there's mainly like 3 pillars. The first pillar is about excellent science. Here's where you have all these ERC proposals. This is like kind of the Oscars of research. You have the starting for young researchers, then the consolidator. The consolidator, and the third one is advance and consolidator. Yeah, that's right. Then you also have the Marie Curie projects here. Then on the right hand side, you have pillar 3, which is more innovation related projects. That's also interesting for companies, SMEs, and so on. And then pillar 2 in the middle, that's what I will be mainly talking about today, which is centered around 6 different clusters. You can see them here. So health, culture, civil security, for society, digital and industry, climate, and food. So for us here in the room, the most relevant one would be health. Some figures is Horizon Europe is the biggest European funding program. It has close to 100 billion euros for the period 2021-2027. So it's quite big. You see that the red chart is for the challenges. So the biggest part goes to these different challenges. And from the challenges, you see cluster 1 has one of the biggest budgets with over 8 billion euros for the whole program. Okay, like good things in life, funding opportunities come in different sizes and colors and shapes. There's many different programs, sub-programs, instruments. I mean, even for people that work a day to day on these kind of things, it's very difficult to follow all the different programs that are appearing and platforms and joint European whatever. So I'll try to guide you through the most typical ones. One of these collaborative projects has normally you create it in response to a call for topics from the European Commission. So the European Commission publishes what they call work programs. Normally they are bi-yearly, so it covers 2 different years, 2 consecutive years, and they list a number of topics where they want to fund projects, right? So then you apply for them. If you get it, projects are normally duration between 3-4 years, sometimes a little bit longer. Budgets around 4, 8, 10 million euros, sometimes a little bit bigger. And typical consortium is 8-10 partners, but can be. I participated in a project that was 40 partners there, so you can imagine the meetings are like assembly. You have 2 people per partner, so you just fill the room with just with the partners in the project. Very quick intro to TRLs because this is relevant for later on. Most of you are familiar with TRL, but for the others, this is like some kind of classification from the European Commission, although it's copied from NASA, to determine which is the level of your technology, meaning that 0 is more conceptual, 1 is like lab, very first lab experiments, 2, 3 is proof of concept, then 4, 5 you have an early prototype, 7, 8 more or less the same but closer to real conditions, and then 9 means that your technology is in the market, right? So there's 2 main type of actions for these collaborative projects. You have RIAs, research and innovation actions, and IAs, innovation actions. Go very quickly through both of them. So RIAs, they include activities like applied research, technology development, integration, testing, so on. And the idea is to bring technologies or solutions from starting TRL around 3, 4 and move it up to around 6, okay? Yeah, the minimum consortium is 3 partners from 3 different countries, but normally it's bigger consortia. And then all partners in RIAs receive 100% funding for their work. On its side, IAs are more or less the same, but without the research component, or I would say with not so big research component. You can have a little bit of research in IAs, but it's basically mainly about prototyping, testing, demonstration, validation of use cases. So this translates in starting TRLs between 5, 6, and then ending final TRLs by the end of the project around 8. Again, the same with the consortia. And here it's important that, I mean, academic partners, most of you are also 100% covered, but companies, they just get 70% co-funding. The idea behind is that the technology is closer to the market, so they should be covering part of the cost, right? Okay. Some ideas about defining a suitable project concept, some tips. This is the ones that didn't raise your hand, and this is European projects. This is just to reflect. We've had some discussions in the past with some of the partners in HybridNeuro. I always, I mean, I work at the UPC, and most of my work is trying to kill project proposals from my colleagues. They call me to their office. They say, Juan, I want to build a project. I go there, and I put my sleeves up, and I say, no, this is not fitting the call. No, you don't have a partner suitable for. So I try to kill it. Why? Not because I mean, I get paid to get projects to the university, but just because I know how difficult it is to put together these kind of projects. I know that they have to be perfect from the very beginning. They need to have a perfect fit with the goal.
they need to have a perfect consortium. They need to have a perfect European dimension, what they call European dimension. So the integration of the different partners and why the project has to be European and not national, regional, whatever. So this picture is just to say, okay, think about it. The first time, especially the people that are not so used to European projects, because it's a really intensive process, especially if you are in the driving seat, if you are the coordinator or one of the core group partners. Okay. So that's why I created these 7 gatekeepers to keep my colleagues away from me. So unless you meet all these, I'm joking, of course, unless you meet all these criteria, in my opinion, that doesn't really, it's not really worth the try, right? So is it a suitable call with acceptable timing? Suitable means that the topic fits very well from the very beginning with no exceptions with your idea. And acceptable timing does not mean a month before the deadline. That's what some of my colleagues think. In my past experience, if you want to create one of these collaborative projects and you want to do it well, you want to have minimal chances of getting it, you need to start working around 6 months prior to submission. Sometimes 5, 6, it depends a little bit on your own network, how developed are the ideas or so on, but that's more or less my estimates. Does your project idea fit perfectly into the call? Do we have the necessary time and energy to build a top proposal? So you really should ensure that the following 4, 5, 6 months, especially if you're the coordinator, you're going to be there and you're going to be devoting, I don't know, 60, 70% of your time to that project proposal. Otherwise, it's very, very difficult. Are there EU partners that can and want to cooperate with us? Can we wait around 1 year to project kickoff? This is more a question probably for industrial partners. I mean, academics, normally we can wait for 9 months, a year until we get the funding and we start the project. That's normally not a huge of a deal, but can we accept partially sharing the results? Again, this is a little bit more for companies. And do we envisage an ambitious and high quality project that can compete at EU level? And the competition is increasing more and more every year. We said, and the people that participate in EU proposals, you are all aware of this. You find calls where the success rate is below 2%. Meaning that just 1 out of 50 proposals make it, and maybe 20 of them are crappy and 15 are okay, but the rest are also very good proposals. So that's why I say, if you're not starting from the very beginning with a very good fitting idea and a lot of energy, don't even try. Well, this is the typical process of proposal preparation. You start with the idea, you find the opportunity, the call, then put together the partners and the idea, you create the project, then write the proposal, submit it, and then you have the evaluation by independent evaluators. So some tips now about building the consortium. These are the different roles that you can have in a European project. And of course, the more, the 3 first are the ones that have more power regarding the steering of the project and the decisions about the consortium and so on. So initiator, but also initiator is normally also the coordinator, but sometimes you can initiate a proposal and then ask a third party to coordinate. That's also typical sometimes. And then core group partners are typically 3, 4 partners that are the first one to join the project proposal, and they put the main layer, let's say, of the main ground for the project. You can decide to be a partner. I mean, you will not have so much power and decision making and so on, but you will also work much less than the coordinator for sure. So it's a little bit a decision to be made. So regarding core group creation, well, you typically define your project together with 2, 3, maybe 4 organizations. They are those key players that you need to bring together to make sure that the project is a success. And normally, you also have like different backgrounds. Normally, these 4 partners are not the 4 of them academic partners. Normally, I don't know, you're thinking about clinical project, you would have a Maribor, for example. If they were the coordinators, then you can have a clinical partner who's going to be testing the pilot, demonstrating the results, and then you have maybe a company that is going to be following the project and adopting the solution to sell it in the future. And so you start with partners with different and complementary backgrounds, ideally. And of course, you want them to be highly committed to the project. Sometimes you see that some people are not already at the proposal stage, not very motivated, not investing a lot of time, not really helpful. I mean, you can imagine how these people are going to be working with you for 3-4 years afterwards, and probably also non-enthusiastic, not very collaborative. So, I mean, with the years, you develop a sense of who is going to be helping you in the process of proposal building, but also in the process of project implementation if it's awarded. Yeah, again, so some criteria for selecting your core group members, organization's background, motivation, interest on the results, experience that they can bring to your project. That's also useful. And then personal affinity with people. That's also interesting aspect. Yeah, and then like a little bit what I said, you want to be surrounded by people that the younger audience probably don't know these guys, but you know, there was the guy that made the plans here. The other one was like the brutal force, the chopper pilot, whatever. So I mean, each of them had a role, right? And it's a little bit the same with the proposal building, with the consortium building. Yeah, about writing a winning proposal, again, some tips. I cannot insist more on this. Your chances of winning an EU project with a rock-solid proposal, 0 or 0, but in yellow. It's 0, really. Don't even try. It's getting crazy. Last one of the last proposals where we participated, success rate was even below 1%. So yeah, I think I'm saving a lot of time from many people here in the future if you remember this graph. Yeah, this is what I say, the 50 about the, remember we're discussing about the proposal building, the writing of the proposal. I always say there's 50-50 rule. There's 50 of the project success, half of it is having the idea, making sure that it's really ambitious, scientifically ambitious, making sure that you're surrounded by the best partners, drafting a very nice work plan that fits with this scientific challenge that you are proposing. But that's just half of it. Then the other half is how to put all of that into 30 pages, 50 pages. That's the only thing the guy over there at home, they're going to be receiving and reading and giving scores to it, right? So it's equally important, the product quality, the quality of these cookies to be able to sell the product than the packaging, which resembles an album, which is very nice. So this is just to convey this idea. You can have very, very nice scientific and ambitious and wonderful consortium proposal, and then have a crappy, like a sloppy document with not very nice pictures drafted in 2 weeks or just very quickly. It's not going to make it. So I think it's very important, this 50-50 rule. So some thoughts on proposal writing based on my experience. Just the writing of the proposal. Once you have fixed, you have frozen everything, just the writing of the proposal, in my experience, if you want to do it well, it'll take you 2-3 months. Now with ChatGPT, and many people are using it for the for the narrative flow, I mean, it helps a little bit if you have the ideas. It can really be helpful. So maybe that time can be reduced slightly, but I would say no less than 2 months. Because again, it's not something you write on your own. It's something that it's cooperative, and you are discussing with the rest of the partners. So it takes time. Takes time and iteration with the partners. Make sure that you involve the partners, the rest of the partners from the very beginning. If you're the coordinator, especially so that they contribute, they feel part of it, and they are really adding their knowledge and ideas to the concept. Yeah, in general, follow the forms and recommendations. I mean, you can be innovative in the content, but don't innovate with the proposal structure or anything. And of course, use good images. Oh yeah, no, it's fine, it's fine. ¿Cómo lo hacía aquí? Okay, no, it's done.
And wait.
So in general, a little bit of recap of what makes a good proposal. The starting 11 would be like a perfect fit with the program, very clear objectives and ambitious objectives, scientific excellence and innovation, having a sound impact, and the topics, they also mention what kind of impacts. If you read a topic, they're normally a page and a half. You read it, they give a little bit of context, expected outcomes, and they also indicate what kind of impacts. We're talking about health topics, and they typically say, yeah, we want to extend the life of people with high quality life for 2 years. So we want to have less burden on the health public systems. I mean, they already indicate the kind of impacts that they are looking forward with the winning projects, right? European dimension, this is what I mentioned before briefly. This means that your project is not region. I mean, if it could be made regionally or nationally, it's probably not a European project. And that's why many times you have like different pilots in different parts or regions of Europe, because then you can demonstrate that it serves different, let's say, societies, different types of people and how they suffer a certain disease, for example, in different countries, different health public systems. So that's why you typically have sometimes 3, 4 use cases or pilots to demonstrate that the results of the project are not just for one country or one region, but they are replicable across Europe or certain parts of Europe. Then balance distribution of workload between the partners, but also between different backgrounds of the partners. Do not put everything on industry or not everything on academia. It has to be balanced, clear timescales and work plans. Role and complementary of partners in the consortium, technical but understandable language, industrial relevance, and a well-defined marketable project result. Okay, before moving into the topics that I prepared for you today, the last section about the evaluation process. So everything you do ends up in these 350 pages, you send it, and then you don't hear anything from the commission in 3 or 4 months. Normally is a no. So, but what happens in the middle is that this proposal is sent to evaluators who receive the project. They evaluate it according to certain criteria. Then there's typically 3 of them for very large projects. It can be up to 5. Then they put together kind of the reporting from the evaluators. There's a consensus group, and then you give the final scores and the ranking, right? And based on the ranking, you start financing the first one, second one, third one, until the money you run out of money. Some lessons learned. I'm an evaluator myself of European projects. I can tell you I dedicate more, but I know that a typical average is between 2-3 hours dedicated to evaluation. So that's why I insist so much on making a very good proposal, because it has to be perfect to the eyes of the evaluator that is going to be dedicating half of their morning or afternoon to your proposal. So make sure that it reads with a nice narrative flow, that it has all the visual elements to convey all the information, make it easy for them, okay? Yeah, also bear in mind that some of them are very specific, maybe on your neurodegenerative, whatever rehabilitation, very specific topic, but some of them are going to be generalist. And you can have people that may be consultants or business people, or so, and make sure that you can get very technical in certain sections, but make sure that across the proposal, it's readable and understandable to the lay person. That's also one of my tips for proposal writing. Yeah, and collect as much information as possible from NCPs and national contact points, other people about the proposal. Okay, final slide about this. Consider the evaluator is a buyer. They have scarce time to invest in the purchasing process, and they have a limited amount of money. They're in search of excellence. The supply is much higher than the demand, and they have the value for money criteria in their minds when scoring proposal. Okay. Okay, now we jump into some topics that we found interesting to the hybrid neuro community. I'm going to be showing probably not all of them because we're running out of time, I think, but maybe 2, 3 of them. We have already this is still based on a draft, the latest draft of the work program that we have for cluster 1, which is health, the most relevant to all of you. And I said before, there's like topics for coming in 2026, but also topics coming in the year after. Okay, so for example, in 2026 we have these disease 2, which is innovative interventions to prevent the harmful effects of using digital technologies on the mental health of children and young adults. You see here that the expected outcome is that proposals should contribute to all of the following outcomes. So you have to, with your project, contribute to all these 5 bullet points. So researchers have an improved understanding of the neurobiological and cognitive evidence based on the impact of digital technologies on mental health. Policymakers are provided with robust evidence on the impact of digital technologies. They are asking you to implement newly developed interventions, and they give a few examples, so we'll see them in next slide. Children, young adults, and families, they access these interventions. And then finally, they are also able to develop resilience and be empowered to fight against dependency or whatever, okay? So that was the expected outcome for this topic. Now I'm going to show you the scope, which is the other part of the topic, where they more or less frame what kind of content or what kind of activities you should do. So, yeah, they ask you to develop testing digital interventions. They ask to leverage multi-source data, for example, sleep patterns, heart rate, stress levels, screen time analytics, social media use, biological data, clinical data, and you can also involve AI in there. And then you should address in your projects the following aspects, these 4: generate neurobiological and cognitive behavioral evidence base, develop these digital interventions, and they give examples here, for example, counteracting addictive design patterns, gaining insight into risk patterns and enabling early risk detection, redirecting users towards healthy use and positive engagement, etc. Okay. Then assess the changes in behavior through these achieved through these interventions, and then they also mentioned this is open to address any mental disorders caused or aggravated by the use of digital technologies. Okay, this is an example of a topic. So you see how it reads. I summarized a little bit, but this is more or less what a topic looks like. I skipped this at the very beginning. This is RIA. Remember when I explained before research and innovation action? So for every topic, they tell you if it should be a RIA or an IA. So now you already know, all of you, what we're talking about. This is the deadline. If any of you is interested in this particular topic, it's not official, not open yet, but 99% it'll be with a deadline April 2026. And they are financing, in this case, between 5 and 6 projects, 8 million euros each. Okay. Yeah, maybe this other example, they are asking to identify, proposers to identify and address low value care in health systems. This means activities or practices that have a cost, either in money or in efforts, in personal, and whatever, but are not really bringing an added value to the health system. And it can be anything. As you can see, many of these topics, they are very open. You read it and you say, okay, but what are they? I mean, they leave it a little bit to the proposers to think about reasonable proposals that can really have a very, very big impact. So again, they should contribute to all the, it's a RIA, the same deadline. And in this case, they are financing 4 projects of 10 million euros each. So they want to identify these low value care practices, implement guidelines for reducing or even discontinuing these low value care activities. Of course, patients and citizens, they will benefit from more effective healthcare because you can dedicate resources to other more pressing or relevant activities. Yeah. And then the scope, contributing to waste, cost, and misuse of resources, blah, blah, blah. Yeah, proposed activities may also include data models and AI-based analysis, models and tools to identify or address low-value care. So again, the objectives develop deeper understanding of how low-value care can be identified and measured. Identify instances of overuse, misuse, or underuse variation in a specific healthcare context, and develop or pilot initiatives for effective reduction of this type of care that doesn't bring any value to the health community. Okay. And again, here they very explicitly they say that these interventions or these pilots they should demonstrate scalability and transferability to the whole Europe, or as much as possible, not just an intervention that's appropriate maybe for a very specific region or context, but to the whole Europe. Okay, I think I'm gonna miss this one. I don't know how much time. I think I'm over time already. So maybe just one more. Do you like the virtual twins or the clinical trials for advancing innovative interventions for neurodegenerative? Yeah, maybe this one. So this is a RIA again. This is for 2027, and this is a particularity. There are some topics that it's not just one submission, but it's a submission in 2 stages, meaning that the first submission is a short proposal around 10, 12 pages. If you make it through, then you are invited to present a full proposal, right? So in this case, early April 2027 first stage, September second stage. They will be again funding 4 projects, 10 million euros each. Okay, so proposals here should contribute to the following outcomes. So scientific and clinical communities. They develop innovative interventions aimed at more effective treatment for neurodegenerative diseases. The community benefits from the exchange of ideas, knowledge, and best practices. They make a wide use of relevant databases. Then on the other side, policymakers, scientific and clinical communities, and patients organizations, they are informed of the research advances made and the requirements for a widespread implementation of these interventions. And yeah. And then the scope. Yeah, they start by saying that there's a huge need to develop more innovative therapeutic solutions for these diseases. They have an increasing prevalence in an aging population. There's not very many effective like therapies and so on. So they really need to advance in this direction. So yeah, you're supposed to create early stage clinical trials. Then you can involve imaging, MRI, ultrasound, nuclear, as well as physiological, molecular, biochemical, or omics signatures. Okay. Yeah, again, they speak about artificial intelligence, wearable technologies also to help implement and monitor the long-term efficacy of these interventions. And yeah, you are called to use existing data, biobanks, registries, and courts, blah, blah, blah. Okay. Just to give you a little bit of ideas about what's coming, some of them are, I think, useful for most of the community here online. There's many more. I didn't want to put a lot of topics in here, but I mean, if you are interested anytime in doing something with us and with the hybrid neuro partners, feel free to reach out, and we'll be happy to discuss with you. Also for the people online. Yeah, I think that's everything. Yeah, this is a brain health partnership that's coming also. Yeah, as I said before, there's so many initiatives coming every year almost that is difficult to follow. Yeah, I hope that now your skills with your proposals have increased a little bit with this very long talk, hopefully. Just one final word. Tanya also asked me to present this very briefly. This is about that other EU Fusion project right there. Also, Maribor and ourselves, we are partners in this project. And it's basically about putting together a community of expert facilitators, like ourselves, like Tanya herself, like we with business development, with European projects, and people that facilitate the co-creation of projects. We are gathering in this platform. There's like 4 different verticals you can see in there, like AI, which is the one led by Maribor. There's the health technologies led by us, UPC. Then there's mobility led by Karlsruhe Institute of Technology, and then advanced manufacturing by KU Leuven, University of Leuven. So the idea is that these expert facilitators, we gather in this platform, we exchange ideas, we do a little bit of networking, and yeah, it's a very nice environment. We're starting with it. The community is growing, and there's also training, free training for people on soft skills, on many aspects that could be relevant also for younger audience. So just feel free to scan the QR and register, and yeah, welcome there if you decide to join. And now that's everything on my side. I don't know if there are any questions. We have time for questions.